Vaccine pass requirements have been lifted, and even those unvaccinated residing with a COVID-19 patient are exempt from quarantine as long as they test negative. For more on the latest ease in COVID-19 restrictions and its potential impact in addressing Omicron, I have Dr. David Kwok from Sooncheng University Hospital. Welcome back, Dr. Kwok.
Good afternoon.
I also have Dr. Alice Hyung-Tan at Miss Medi Women's Hospital live on the line. It's good to have you on, Dr. Tan.
Always a pleasure.
Meanwhile, over in Canada, I have Dr. Daryl Falzerano at the Vaccine and Infectious Disease Organization. Dr. Falzerano, it's a pleasure to have you with us.
It's a pleasure to be here tonight.
Right. Dr. Kwok, let's begin with your understanding, that is, of the government's decision to grant a greater sense of autonomy to members of the public in efforts to address Omicron.
Well, so as the KDCA has made a formal statement already, I think they're trying to allocate resource-heavy duties to that's what's more needed currently. So instead of allocating these governmental workers to take care of all these mild cases and also to govern over the people who are to keep their eyes on whether or not people are actually keeping social distancing, I think they're trying to really heavily allocate these human resources to those people who might need their hands, such as those people who are immunologically weakened or those people who might have a better chance to become more severe from the illness. I think there's also an issue with such method as vaccine passes of equal opportunity. So if it was implemented to different venues and businesses, we face an issue of what would benefit from the vaccine passes and which kind of venues do not so much benefit from it. So I think overall they considered that the vaccine passes or much stricter, harsher social distancing did not really benefit in overall senses of keeping transmission preventable in a sense because it's also spreading widely anyways. So the government has made the decision to really discard all the harshest and strictest social distancing for the time being, mainly to focus their focus on those people who need the care most at the moment. And I agree partly with their decision, being careful though, because the fire is in its full amount right now. We have no ways of really just suddenly cutting it down. So we better really focus on whom we can protect even better from this point on.
Right. And Dr. Tan, as part of the latest shift in COVID-19 restrictions here, those unvaccinated, as I mentioned earlier, living with a COVID-19 patient are free to engage in their daily activities if they test negative. What precautions do you care to highlight?
Well, first of all, as you said, people need to test. There is a testing requirement. So the first test needs to be a PCR test. And then during the 7-day active surveillance period, they will be checking their health status twice a day, morning and night, to see if they develop any symptoms of COVID-19. And at the end of the test of the active surveillance period, they have to test again. And at that time, it's a rapid antigen test. Now, the risk of COVID in our country is quite high right now. According to the New York Times, our country ranks 7th in the world for the incidence of COVID-19 per 100,000 population. The secondary household attack rate for COVID-19 in our country, according to the KDCA, and this was reported actually in the March issue of Emerging Infectious Diseases of the US CDC, is actually 50%, which is quite high, but it's not 100%. So there are things that you can do if a household member has been diagnosed with COVID. First of all, everyone needs to wear a KF94 mask at all times. There should also be a separation in living space between the affected or the infected person and the rest of the household, including they should be using a separate bathroom, they should be eating in a separate place and spending the most of their time in a separate space. Ventilation is very important. All the windows of the house should be open for at least 10 minutes, 3 times a day. And if you can get a cross current in your house by opening windows in opposing walls, that's actually better. If you can use a HEPA air filtration system, that will also help. Disinfecting household surfaces with either a disinfectant spray or a disinfectant wipe is also very important. And it's also you have the responsibility of making sure that you do not inadvertently spread COVID-19 to others. So even if you are not under strict quarantine, it's only active surveillance, you should try to, if you can, test yourself before leaving the house with a rapid antigen test. Also limit the amount of time that you're spending in the community to 2 hours per day. Limit your activities to those that are only essential activities. And then, of course, do not spend time in public spaces, and do not visit places where people who have high risk of developing severe disease due to COVID reside or are active. In other words, places like nursing homes or care centers for people with disabilities. Please do not go to these places. And this actually applies not just during the active surveillance period of 7 days, but also for 3 days after that period. So for 10 days, do not go into these high-risk facilities.
Right. Meanwhile, Dr. Falzarano, I understand several provinces over in Canada have recently announced a rollback of pandemic restrictions given the steady decline in the number of infections there. Could you tell us a bit more about this?
Yeah, so depending on where you live in Canada, restrictions are starting to lift. So mandatory masking restrictions are being lifted. The need to present a proof of vaccination to enter a facility, that is going away. And as well, some of the self-isolation rules. So if you're in contact or even if you're COVID positive, the mandatory 5-day self-isolation rules are going away, and it's up to the individual to make a responsible decision as to whether or not they self-isolate. This isn't being done blanketly across Canada, so it's up to the provinces to set the health guidelines, and so it's not the same in every province, and they're not being rolled back at the same time. So some provinces moving sooner than others. The province I live in has lifted essentially all restrictions as of yesterday.
Right. Dr. Falzarano, what are your thoughts personally on the wisdom of abolishing, let's say, the mandatory isolation period for COVID-19 patients?
So that people are still highly encouraged to self-isolate. And really that was never enforced before, right? There was a public health order saying that that's what you should be doing. But there is no people enforcing those regulations or that isolation period. So people should continue to self-isolate and do so to protect others. And that's largely how the whole approach is going. So it doesn't mean you can't wear masks places where you think that there's a higher risk. You're still allowed to do that. Businesses are still, letting their employees be masked. You can wear a mask into businesses. It's just that it's more loose. There's more freedom to do what you want. And I guess it's really going to be an experiment to see how it goes over the next probably 2 to 4 weeks to see what happens in terms of overall case numbers.
Right. Meanwhile, Dr. Kwok, many agree that Korea itself has yet to hit its Omicron peak. And that being said, do you see the latest lifting of COVID-19 restrictions here in the country as perhaps affecting the timing and scale of our Omicron peak?
Well, I'm pretty sure it would. Any sort of changes in the social distancing guidelines would definitely have an impact on the speed of the transmission, because obviously without such harsher restrictions, more people are going to come into exposure from the virus, and also there'll be more chances for whoever the generation or whoever the people might be to become ill from it. So I think in any case, I think the easing of the restrictions could possibly bring forth the peak at the time, which was speculated to happen in mid-March. But I'm pretty sure KDCA also had that in mind when it made the statement that they expected to see the peak in mid-March. There are other projections made by different affiliates which projected quite possibly that we've had actual peak of the actual cases back in late February, but instead the detection number, we could hit the peak in about 6th of March. I'm dearly hoping that by this week we would hopefully go over the peak and we would start to decline. But another fact that we have to consider is that roughly in any other countries that overcame the peak already, took about the same amount of time from the peak to really go down to the numbers that they used to have really low before being hit with the Omicron variant. If that is the case, that's about to happen in Korea as well. We took at least, this is about the 6th week that we're going into from the beginning of the Omicron wave. So if we were to hit the peak this week, let's say, it's going to take another 6 weeks to 7 weeks for us to actually go back down to the lower numbers. So all in the while, we keep going to have these patients come up with illnesses from COVID-19, let alone quite possibly severely ill patients from COVID-19. I believe the Korean government is currently saying that we have to about 2,000 units of capacity to take care of ICU bed patients. From a couple months ago, we had a huge problem filling people in the ICU beds when we had we were hitting about 800 to 900 people back then. We were met with the huge consequences back then. People were dying because they couldn't get into hospital. I'm not entirely sure how, so we have reached about 1,000 more bed units by now. But if while we're still in here, we really need to heavily focus on how we're going to manage once we also start to see a steep rise in the numbers of patients who become severely ill from COVID-19, because that's about to happen very in the near future.
Right. And back in Canada, Dr. Falzarano, do you believe the country has passed its Omicron peak? And if that is the case, how does the ease in restrictions there look to affect containment efforts in the future?
So I think that is one thing that we can confidently say at the moment, that it does appear that we are past our peak. So the peak in cases would have been in early to mid-January. A peak in deaths attributed to COVID-19 followed in early February, and then case numbers have trended down since then. And the matching data, wastewater testing is also trending down. Hospital admissions are decreasing. However, we still have 6,000 cases today with an 11% positivity rate. And really, we've just fallen down to a level from being very high to just under previous peak levels. So there's still a lot of Omicron transmission, Omicron cases in the community. And that's why the lifting of the restrictions at this time, while we are in a much better spot than we were 2 months ago, it's really going to, how tolerant we are to how well this is going to work is going to play out over the next, 1 to 2 months.
Right, only time will tell then. Dr. Tan, some medical experts here say the government's recent actions are premature. What are your thoughts? And given the latest events, what do you propose to better prepare for the possible risks ahead then?
Well, given the fact that we've not actually peaked yet, it does feel premature to me. In terms of what's going on, basically the burden of responsibility for protecting ourselves against COVID-19 has been shifted from government mandates and restrictions to individual choices and behaviors. And so what can we do? Basically, I think education is one of the most important tools still that we can use against COVID-19. We need to educate the people on what the risk level is for getting infected. And as I said, in Korea right now, the risk level is very high. We also need to educate people in terms of what are they risking in terms of the full spectrum of disease. Yes, there are many people who are just going to have mild or asymptomatic disease, but there are many people who are going to be very uncomfortable during acute COVID, and they also risk what we talked about last time, chronic COVID. And we now know that there are higher risks of developing cardiovascular disease, stroke, and diabetes after complete recovery from COVID. And so these are long time risks. This is a legacy of COVID that we need to be aware of. As our other panel members have stated, just because the government doesn't mandate certain things anymore, it doesn't mean that you can't still do them. If you're going to go into a public space, there's nothing stopping you from asking the proprietor, the owner of the business, hey, have all your employees gotten vaccinated? Are they boosted? There's nothing stopping you from asking your friends before having a gathering, hey, are you all boosted? There's nothing stopping you from having your own personal policies to safeguard yourself and your family against COVID-19. And I know that's what many people are actually doing. Even if the government doesn't require it, we know how to keep ourselves safe. And there's no reason why you, as an individual, can't keep on doing these measures to stay safe and protect your family.
Right. Dr. Than mentioned boosters. Dr. Kwok, starting this week, second booster shots are being offered to those who are immunocompromised here in the country. What are your thoughts on the efficacy of these additional shots?
Right. Sorry.
No, that's fine. I was just going to ask you about the efficacy of these fourth doses here in the country.
Right. So we're mainly talking about fourth doses, and I want to iterate that these are not being given to just normal, healthy people walking around on the streets. I realize that there have been many debates about whether or not the fourth shot was really needed to protect people from transmitting the virus. But let's focus that the fourth shot given here is not to really stop the transmission, but rather to protect those who are immunocompromised. These are people who are less likely than others to build as strong of an immunity from the same amount of dosages that other people have received to fight against COVID-19. So these are the people who have greater chances to become more severely ill or possibly even die from the disease if they are to be exposed to the virus. The debate was mainly about whether or not the normal people, healthy people, could benefit from fourth shot. And it was several different studies showed up that different results, but mainly it resulted in results yielding people not clearly benefiting from the fourth shot. But this, and I want to repeat myself, are not the healthy people walking on the streets. They are immunocompromised people. So I believe the fourth shot would definitely benefit them in regards to protecting them from possibly, after being exposed to the virus, creating a severe illness from it.
Right. And Dr. Falzarano, what has been the impact of the second booster shot for the public over in Canada?
So again, we've deployed them the same way that's being deployed in South Korea, where it's highly vulnerable populations, immune suppressed, elderly, high frailty, and people in care homes who are being offered fourth doses. And these people are actually 4, 5, and 6 months out from their third dose in facing an Omicron wave. And so at the moment, the data seems to support that they are continuing to be protected from severe illness. Not, of course, from infection, as we know with Omicron. Unfortunately, the vaccines are not being very effective at doing that. But that's not always the goal, right? So the goal really should be protection from severe illness. So in that case, it does seem to be hitting that metric.
Right. Well, that is good to know. Dr. Dan, the new academic year began today on this Wednesday here in the country, and the vaccination rate among those aged 13 to 15 reportedly stands at 71%. How do you assess this finding, and what are your thoughts on plans to offer a third dose to young teenagers?
Well, as a doctor, I will say that the evidence about receiving a third dose in adolescents is evolving. And the WHO and the EMA, they continue to state that delivering boosters to this population, the adolescents and teens, is lower on the priority list in terms of vaccination campaigns. But, you know, I'm going to talk now not as a doctor, but as a mom. One of my daughters actually got COVID in January. She had been boosted, or she had received 2 doses of the Pfizer vaccine and was 1 month out of being eligible for a booster shot. And I can tell you that for 2 months, she really suffered. She was extremely tired. She couldn't keep up with her schoolwork. And it was getting to the point where she was so exhausted and anxious and depressed, I actually had to talk to her about possibly taking a leave of absence from school. And I found it so incredible that I was having this conversation with her because like so many other children around the world, she was not able to go to school for 2 years, online learning. Now she's finally in school, and I have to talk to her about possibly taking a leave of absence from school because of the symptoms of acute COVID. And she's a previously very healthy child. So all I can say is, you know, we've had more than 52,000 children and adolescents infected with COVID yesterday alone. 12,800 children have died due to COVID-19 around the world. We need to protect our children. The suffering that they go through is real. And just by telling you, mom to mom, you know, if I could have gotten her the booster earlier, I would have. There's nothing worse that I could experience, I think, as a parent than watching my child suffer and then know that perhaps that I could have possibly prevented that. And so I encourage our government to consider rolling out boosters sooner for our children and for parents to make sure that their children are fully vaccinated against COVID-19.
Dr. Dan, I hope your daughter feels better now.
Thank you. She's much better, but it took a long, long time.
I can tell. All right, Dr. Dan, as always, thank you very much for your insights. Dr. Falzarano over in Canada, thank you for being with us today. And Dr. Kwok here in the studio, thank you for your thoughts.
Thank you.